is 3 months, my friends, since I have talked with the people of this country about our national problems. But during this period, many things have happened, and I am glad to say that the major part of them have greatly helped the well-being of the average citizen. In the short space of these few months, I am convinced that at least 4 million have been given employment. Or saying it another way, 40% of those seeking work have found it. That does not mean, my friends, that I am satisfied or that you are satisfied that our work is ended. We have a long way to go, but we are on the way. We come to the relief, for a moment, of those who are in danger of losing their farms or their homes. I have publicly asked that the foreclosure on farms and chattels and homes be delayed until every mortgagor in the country has had full opportunity to take advantage of federal credit. And I make the further request that if there is any family in the United States about to lose its home or its farm, that family should telegraph at once, either to the Farm Credit Administration or the Home Loan Corporation in Washington, requesting their help.
That was President Franklin Roosevelt in 1933. I think this is going to be very interesting for a lot of people listening and watching this today. David Stuckler, the choices made then and the choices being made today.
Completely different. Roosevelt took bold steps at a time when debt was 180% of GDP to boost financial relief to the newly unemployed, to save Americans from homelessness. And we've studied the effects of his landmark program, the New Deal, on health. And what we found is that comparing the states, the red and blue states, that pushed it to different degrees, the blue states tended to go further with the New Deal than the red states, led to a polarization in public health outcomes across the U.S. The greater relief spending implemented under the New Deal helped reduce suicides, reduce tuberculosis and pneumonias, and was in fact the biggest and one of the most effective public health programs on U.S. soil.
When you hear politicians today saying we've got to cut Obamacare, we've got to cut health care in this country, talk about what you found, what it means for the economy to invest in public health.
Investing in public health is a wise choice in good times and an urgent necessity in the worst of times. Had austerity been organized like a clinical trial, it would have been discontinued given evidence of its deadly side effects. There is an alternative choice that we found in the historical data and through the present recessions, that when we place people and their health at the center of economic recovery, it can help get our economy back on track faster and yield lasting dividends to our society.
The issue of the West Nile outbreak, can you talk about that?
Down in Bakersfield in California, there was a suspicion about why crows were dropping from the sky, and people were also showing up in hospitals. A variety of theories were posited, ranging from polio to heat stroke, but in fact it amounted to a West Nile outbreak that through a number of our colleagues' research, it was found that the abandoned and foreclosed homes had stagnant water and old swimming pools and other locations that were breeding mosquitoes. And this led to a rather large West Nile outbreak. Indeed, the reason why it was discovered was something called the California Encephalitis Project, a group of public system laboratories that work in concert with the CDC. And ironically, after helping to control that outbreak, they were closed due to budget cuts.
I want to turn to the issue of drug abuse. A recent film by Vice has brought renewed attention to the drug crisis in Greece, particularly the use of the new drug called Sisa. This is Haralampos Poulopoulos, head of Kathia, the main anti-drug center in Greece.
Sisa is a form of crystal methamphetamine. They use amphetamines and some other liquids, sometimes battery liquids, to produce this drug. It's very dangerous for the health of the users. I think that the main reason of the increase of Sisa is the changes of the attitudes of drug users during the crisis. They are more self-destructive. We have 27% unemployment, 62% the young people under 25. We didn't finish yet with the crisis. We are in the middle of the crisis.
Haralampos Spoulopoulos, head of the main anti-drug center in Greece, David Stuckler, and talk about that and also relate it to here as we wrap up.
This is a devastating situation we're seeing in Greece, with a drug crisis escalating at a time when drug prevention budgets are being cut. With gaping holes in social safety nets from austerity, people are becoming desperate, turning to the means of self-harm. We've seen drug use and infected needles spread HIV, creating a rise of more than 200%, leading to an epicenter of HIV/AIDS spread in Europe. What we can learn from these mistakes and in areas where we see successes in policy is that recessions can hurt, but austerity kills. When politicians make smart choices to protect people during hard times, it doesn't happen at expense of recovery, but can help put our societies back on track to a happier, healthier future.
And here in the United States, how that translates into policy?
Currently, we're facing implementing a large sequester in the U.S. While it's too early to see the full health consequences, what we are seeing is the Women, Infants, Children's Health Program, which provides nutritional subsidies to women, will be forced to reduce those subsidies from 600,000 pregnant women, and that program's been linked to reducing infant mortality. We're also seeing large cuts to public housing budgets at a time when 1.4 million homes are still in foreclosure. We're concerned that if done rapidly and indiscriminately, that budget cuts in the U.S. could create a repeat of the disasters we're seeing in Europe.
Final comment, what most shocked you in writing The Body Politic, Sanjay Basu?
You know, coming from the public health field, we have something called the Precautionary Principle, which is that when idea or policy is controversial, we should first do whatever protects people the most. And what we're doing is entirely the opposite. We've essentially had a massive untested experiment. That experiment has failed, and it sounds like it's quite deadly given all the data through history.